What's going on, guys? Welcome back to W.D.Y.D. CSP. What do you do as a central sterile processor? Guys, we're going back to basics and we talking endoscopes. Guys, we're not in the prep and pack unless we are going to sterilize these scopes. And the only, for this specific scope, which is a model HQ190, the only sterilization method recommended for this scope is ETO. And if you're still doing ETO, guys, God bless you, but follow those IFUs. And then in the prep and pack area, guys, it is inspection, guys. What are we inspecting? We are inspecting for cleanliness, guys. Cleanliness of these scopes here. All right. We are using our lighted magnifications, which we should have used in decontamination, guys, right? Before we pass this over to the prep and pack side, we want to inspect the exterior of this scope. If you're doing borescopes over in the decontamination side, that can be a little tricky because the interior of the scope is still a little moist. Passing a borescope in there in wet conditions can be very difficult, but many people find that very useful. That's an option you have, guys, is to send a borescope down there. But I always find that using a borescope in a wet environment can be really deceiving because moisture can hide soils, right? Think about some of those soils that are white. When they're wet, they look clear, and then when they dry up, they turn chalky. So it's very difficult over in the decon side. So I always prefer doing inspections over in the prep and pack side, or the side where we're going to continue our process of either high-level disinfecting manually or automated. Now, manually is no longer suggested according to the new ST91, ST91 no longer recommends manual high-level disinfecting of GI scopes because, again, there's so much fault or so many inconsistencies with the manual process. So automation is always recommended, and I agree with them 100%. But let's say it does come over to our side and we're going to inspect. Well, we're going to inspect with a borescope, right? We're going to go down the channels that we can go down with a borescope. So remember, this channel here has two entryways. One that goes all the way into the insertion tube and one that goes into the light adapter body that comes out of this inlet channel right here, guys, right? So you're going to go in straight and then you're going to go at 90-degree angle. Okay, you also can go straight down into this channel here, guys, and then the biopsy channel, which goes all the way down into the insertion tube as well. So if you have a borescope that's long enough that can travel that distance, that is fantastic. You want to use your lighted magnification to look around all your connectors, guys. So all around those rims right there, those are the tricky points right there, right? And then your control knobs. Check your control knobs in between because, again, the doctor's touching it. He's manipulating. He's touching these knobs. He can have mucus on his hand. He can have blood. He can probably, whatever he has, you know what I mean, on his hand. You definitely want to check those control knobs for any kind of moisture, debris, or anything in there. You want to make sure that the knobs work, that everything is moving freely there, that all the buttons actually work, that there's no cracks in there. So you want to look at all those buttons and those knobs there. Make sure you don't forget the knobs on the other side of the scope. Whatever scope you have, it doesn't have to be a specific scope. Just make sure you're looking at all your connectors, guys. All your connection points right here. You're looking all along the shaft of the scope. There, every nook and cranny. And then you want to look at that distal tip. Check out the glass and the light sources there. Make sure that there's no cracks, that there's no adhesive coming off the end where the insertion tube and the flex tube is at. Make sure that there's no cracks in the connections or anything like that. Very thorough inspection. Take your time when it comes to flexible scopes, guys. These scopes have been in the news for far too long, guys, and it's because we rush our process. Slow it down, and put quality into your inspection. Make sure that you're looking at every nook and cranny that you can possibly look into. If you have borescopes that are small enough to get into those little cannulas right there, man, the better. Get in there, look in there, and this is where I think borescopes are a plus and a must for flexible endoscopes, because let's be real, guys, the majority of our processes for endoscopes is high level disinfection, and high level disinfection has its faults, guys. All right, it has its weaknesses. It destroys all microorganisms except for some spores, right? And those some spores are the ones that are going to bite us in the butt. So it's important that we make sure we leave no bioburden on this instrument, that we've flushed it out completely. We've removed as much residual moisture as we can. And be careful when you're getting rid of that moisture, right, guys? That should be done over in the Decon side. But your PSIs of your air should not exceed, for this specific scope, should not exceed 71 PSIs. So do you know what your PSIs are set at, right? Because you can damage the inside of the scope. So be careful with that. We want to go ahead, if that alcohol flush is recommended, then so be it. Do an alcohol flush to assist with the drying, and then proceed with your automated processing of your scope through an AER. But when you do that, make sure you're checking that MEC, guys, that minimum effective concentration. Please follow the IFUs before every use. It's a very simple test. Dip your MEC in there, wait 90 seconds or whatever the IFU of the MEC states. Make sure it doesn't change color. Check the color scheme on the jar there. Make sure it doesn't change. All right, and once you've checked that MEC, okay, it's important that you make sure you put that lid back on that jar, right? Okay, check that MEC. Go ahead and put all the correct connectors onto the scope. It is important that you have the right connectors on here for all the flushing of all the channels. So remember, when you're processing this in an AER, depending on which AER you're using, okay, there's certain connectors that go on there. So your biopsy port, your flush ports, your air inlets, all those got to get connected to your AER, right? That little flush port in the top, there are several connectors, so make sure that you have the right connectors on there. Nice light coil in there, and allow the cycle to happen. Now, once the cycle is complete, guys, in your AER, here's the most important part to me, okay? Was there an alcohol flush and an air flush assist after the cycle, okay? How are you going to store your scopes after the AER? If you're placing it in a drying cabinet, then you need to place the right connectors on there for drying. But handling the scope after the AER is important. So do I handle it with bare hands? You better not, because you're recontaminating the scope, guys. Fresh pair of gloves, clean gloves, guys. I honestly believe, in my opinion, that you should be handling HLD items with HLD gloves. When that's not possible, then they should be sterile gloves. So you should be wearing sterile gloves, and not the gloves that have been sitting on the shelf for 3, 4, 5 days collecting dust with your hands touching constantly. It should be sterile gloves, guys. So grab the scope out of there. Make sure that you're handling the scope correctly, guys. All right, making sure not to damage your scope. Sterile gloves, place it into the appropriate cabinet. Making sure if you're going to dry it, then again, the new ST91 recommends 10 minutes of air flushing, right? And again, it shouldn't exceed 71 PSIs. So flushing until no visible moisture is seen coming out of the scope, and then store away. But if you have a drying cabinet, that's a thumb up to you guys. Handle with care, guys, to not to contaminate it. Make sure it's not touching the walls or the bottom of your cabinet. And then monitor who's grabbing these scopes. Okay, I think that we in SPD should have control of taking scopes in and putting scopes in and out of the drying cabinets. And again, it's with gloved hands, and I prefer, honestly, sterile gloves, because we can't cross-contaminate, guys. All right, guys, as always, stay true to yourselves. Keep it 100. Continue educating yourself. And until next time, peace.